Hi, it's Dr. Garza. Just want to check in with you today and do a quick session on sleep in teens. Just want to make sure that I am viewing questions. Okay, so please send me your questions or comments along the way. Of course, these are always recorded and will be available for viewing after. Um, I didn't schedule this, but I had time right now and thought I would pop on and go over an important topic. Sleep is critically important for physical health and also for mental health. As adults, we know how we feel when we don't get good sleep, if we don't get enough sleep, and that can have a ripple effect on our lives. And so, our children and teens are just as sensitive to that. When patients of mine don't get enough sleep, that may affect their mood. They may feel low mood. It can worsen depression type symptoms. They may feel low energy, low motivation. They may have struggles with concentration and focus. They may feel irritable. Moodiness and even just tolerance and patience and things that affect relationships can be affected when patients are overly fatigued and not getting enough sleep. Um, they may feel easily overwhelmed. That can also be, triggering of anxiety and anxiety-related symptoms. Um, they may feel, again, low energy and low motivation for doing things that they know are good for them, whether that's exercise, whether it's keeping up with schoolwork, and maybe even some of their other kind of household, activities and day-to-day activities. And we also feel that patients that don't sleep well or sleep enough can have a weakened immune system and may be more susceptible to infection. And so these are all really important effects that we notice in my patients and that families may notice in their own children. The basics of sleep issues deal often with what we call sleep hygiene, and that has to do with scheduling of sleep. A sleep schedule is very important for patients of all ages. And, in this time of quarantine, there has been some, flexibility with the bedtime and the waking up time, since, patients aren't getting up and getting to school at 8 o'clock like usual. Um, and so that's nice to have that flexibility. But our body, the drive to sleep is driven by our brain, and our brain has the internal circadian rhythm that allows us to fall asleep at certain times and wake up at certain times. And so if patients are moving their bedtime to very different times every day, what I call an erratic sleep schedule, that can affect their ability to get good sleep. And so, a consistent bedtime is very important. During the school year, it's a little bit easier for patients because they know they have to get up at 7 o'clock, and so they'll kind of back out maybe their 8 hours of sleep and try to protect that time. That's the kind of proactive, healthy way of viewing sleep. Many patients are staying up too late and not getting enough sleep because of just not going to bed on time. The way our bodies know that it's time to sleep is based on that daily time. And what happens is our brain secretes melatonin that drives our urge to sleep. And so, this is the very reason why patients will have, or just people in general have jet lag with traveling with different time zones, or how we're all affected when the time changes each year. And so, having a consistent bedtime is really important. And then it's, what does that bedtime look like? I do recommend patients have a bedtime routine, and that routine can be 30 minutes. It can be even up to an hour, depending on how much time they want to take for it. But the idea is you're really setting the stage for turning your brain off and entering a relaxation mode. And so We usually will say to patients to sign off of their screens at a certain time, at least 30 minutes before bed, and then go through this routine, whether it's, taking a bath, listening to some light music, drinking some herbal teas, doing some stretching, doing some journaling, and being really proactive in getting their brain and body ready for sleep. Screens are, in my mind, a big interference to good sleep. And you've heard about this before, the blue light of screens. And I've had patients say, "Well, I wear blue light glasses, so that's not affecting me in that way." And that's a creative response, but I also believe that the content and the nature of screen use can be overly stimulating to their brains. And so, whether it's something that they're engaged in, Snapchat, or texting with friends, or whether they're even binge watching something that they are really interested in. And then sometimes it's stressful things that they see, whether it's some like drama that's going on in their lives or news. It's hard to really shut your brain off. And so I think the content of screen use can interfere with sleep, but also the blue light. And the way that blue light affects sleep is that blue light exposure prevents the brain from secreting melatonin, and so that sleep onset is delayed. And so that is why we talk about signing off of screens. Now, I also recommend that patients' telephones and their iPads, or however they're keeping up with people, be placed away from their bedroom. And so I think it's important for teens of all ages, including the preteens that have their own phones, or even later adolescents, to have the phone charging in a central area in the home. We've seen this time and again, that having the phone in the room is just very tempting. Even if you put it on Do Not Disturb, I have heard from so many patients that they will have the need to check, want to check, feel like they are missing something, or seeing what someone replied, or saying, "Oh yeah, I want to look at this." And so it's interfering with them winding down and relaxing. So I say, to parents, I support you in having a house rule for the family that all screens are charged in the kitchen on Do Not Disturb, and then have the patient or the teen tell their friends, say, after this certain time I'm not going to be available, and that's just the rule at my house. I tell patients, blame it on me. You can blame it on your doctor. My doctor says I really need to be off my phone at 10:30 or 11 every night, or whatever time is determined, and put it on the parent, or put it on the professional that's advised them of that. And then their friends will understand, and just kind of understand, well, so and so is not going to be available after a certain hour, and maybe they'll even learn from that and say, okay, well, that is probably a healthier balance with phone use and getting sleep. So the phone away from the room is important. um, then with caffeine use is another thing I do talk about that interferes with sleep. It's very important to limit caffeine use if patients are struggling with sleep, and caffeine use, to limit it before 12 p.m. noon, and just one serving a day. I have many patients that overuse caffeine. They're not really thinking about how much caffeine they're having each day, and so a cup of coffee in the morning. A lot of times it's a large coffee. The coffees at Starbucks are, pretty large as far as their total volume and total milligrams of caffeine. And then they may be adding in iced tea, other sodas, other energy drinks. All of those can add up to overdoing caffeine, and then that can be delayed. Many patients will be delayed in metabolizing caffeine up to 10 to 12 hours. And so if they're having it later in the day, that could definitely be interfering with sleep. So that's something to think about. Um, Exercise in general can help patients sleep better, but we do recommend them limiting exercise in the 3 hours before bedtime. Now, I know in the school year that may be kind of hard, but we say, getting earlier exercise, early evening, late afternoon is preferred because your body does get kind of, accelerated, your heart beats up, and sometimes that can be a longer lasting effect as you're trying to wind down. Um, some of the bedtime routine I kind of glossed over that I want to get back to is, what do you do during that time? Again, a bath, journaling. And I've also been an advocate of teaching patients in general terms about meditation and deep breathing. And so, right now, what's great is there are a few apps that are available on people's phones that they are aware of. The biggest one people are aware of is called the Calm app, and it's very useful and user friendly. And patients can sign on where they even have certain routines on the Calm app that are for bedtime, and so they can listen to that. And it's with deep breathing and controlled breathing, and getting their body and brain into a slower, relaxed mode. And so that's a nice thing for patients to use. Also, there's other meditation, guided meditation, and just deep breathing in general slows the body down. Um, let's see. Other things related to sleep is, medication. Sometimes, if patients have done all this and they really are trying to kind of improve their evening routine and their bedtime routine, and they're having a consistent bedtime, and they've really looked at their environment to keep it quiet and cool, and they're still not sleeping well, sometimes we'll help them because we know sleep is really important for their mental health. And a lot of the work I'm doing with patients relates to their mental health. And so if they're not sleeping well, they're just not going to be feeling well. Medications that we start with is we'll often start with melatonin. So, melatonin over the counter is safe to use. We do start real low dose. We typically will recommend what's called a sustained release or time release formulation, and that's one that will help them fall asleep and stay asleep. And so, if they do well with that, then they can use that as needed. Otherwise, we do prescribe medicines, and some of these medicines are can be used for long-term use, and others are for intermittent use. In general, we avoid all controlled substances for sleep like Ambien and Lunesta, that class of medicine. We don't use in teens and adolescents, but we do have other medicines that we use that can be helpful, and those are safe. And we try to choose medicines that patients don't build a tolerance to, that they can continue using and it will be effective, so that they're not dependent on that use. So that is something that we do in our practice as well. um, Therapy has a role with sleep disorders and sleep problems as well. Therapists can use cognitive behavioral therapy to help improve sleep. Also, there's biofeedback and neurofeedback techniques that can help with sleep. And as a complement to our approach and our treatment, acupuncture can be used for sleep problems. And Rosie Cuello is the woman in my office who offers acupuncture, and that is something that she treats in her practice, which is also, very different from the way I approach care, but it is helpful and an option for patients to get better sleep. Um, let's see, that was a lot to talk about. I'm just trying to think if I've missed anything out. Oh, let me just talk about mental health. Sleep issues can be a symptom of underlying mental health concerns related to depression and anxiety. And so when we hear about sleep concerns, we're always screening patients for the other symptoms of depression and anxiety. Is it isolated on its own? Is it related more to the sleep schedule and those types of things, or is it related to underlying depression? So we want to screen for that, and then we want to talk about treatment. And I talked about anxiety last week. I talk a lot about mental health evaluation and treatment, and I'll continue those conversations. But that's also where treatment for depression and anxiety can help improve sleep. That's one of the goals we have, is that it will help sleep indirectly by improving those underlying causes. Um, the other is, therapy addressing depression and anxiety can help sleep by patients feeling like they have ways of coping with emotion that they can use and manage, and feel that they feel, calmer, and so that they're not having racing thoughts and hard. Sometimes patients will feel like they have a hard time shutting their brain off at night because of worry and racing thoughts, and so therapy can help with that aspect as well. So I look forward to any questions or comments that you might have, and I hope you all have a good rest of your Wednesday. Take care.